So we are looking at PowerPoint for today, obesity, diabetes, and pregnancy. So the adjustments that we need to make for all of those populations. So we're going to talk a little bit about what that population is, what the condition is and how it works. Then we'll talk a little bit about like the considerations that we need to make. So looking at obesity, this is the fastest growing health problem in the US, but also really just like in pretty much any industrialized country. Any sort of minority world country has, a problem with like growing obesity. And I know I say like minority world country. That is a new classification actually. That they are working on using, instead of saying, like, you used to hear the word like first world or second world countries. That is an old term that doesn't really reflect things, because you think about, like, it doesn't really reflect the world we live in. Most humans live in not industrialized countries. Most people on this planet live in countries that don't have access to regular internet or even running water. So minority world countries. Our problems aren't so much trouble with running water and things like that. Our problems are that we eat a lot of processed foods and don't move very often. And so we struggle with obesity and things like that. Obesity, we're going to go ahead and define that as a condition of subcutaneous fat. That's just basically fat under the skin, exceeding that of the lean body mass. So a little bit of a different definition here than we've normally seen. The traditional definition, and honestly the one that you will be asked, isn't necessarily this. It is a body mass index of 30 or greater. That's going to be our obesity, right? But it's the overaccumulation of body fat, and it's associated with a lot of different conditions. And you can see many of which are life-threatening, many of which are quite dangerous. So we got to remember what the body mass index is. I know we've seen this before, but it is going to be a calculation of your height versus your weight. Now, is that a great way to determine your health? No, definitely not. Like, this is literally taking into account just your height and weight. And so I love to show people this. Arnold Schwarzenegger, don't spell that. Body statistics when he won Mr. Universe. Did he weigh? There's no way he weighed 154 pounds.
Last week.
It's really impossible. Thank you. At the beginning of his training. Okay, when he was a kid, he weighed 154 pounds. I was like, there's no way. I know he was over like 200 pounds, like for sure. Body weight during Mr. Olympia. There we go. He was somewhere between 225 and 235 pounds. And then 200, so we'll say 225. We'll give him the benefit of the doubt, and then we'll say height, which I'd spelled terribly wrong. 6'2". All right, so he's 6'2". That's 1.88 meters, right? So now, if we go BMI calculator, right? BMI calculator, and we throw in Arnold's statistics when he won Mr. Olympia, when he was literally won a contest for being the most in shape person in the world. 6'2", 225 pounds. If we hit compute, his BMI is 28.9. That puts him just on the cusp of obesity. And then if he was 235 pounds, I believe that puts him just barely over the line. Yep, 30.2, which puts him in the obese category. So I do not like the body mass index as an indicator of health. Now, obviously, Arnold Schwarzenegger is definitely like the exception to the rule. Like, he's almost the exception that proves the rule, right? Like, he's in such good shape, but like, even freaking today. But it's simply your body mass index is a very fast, very easy way to categorize someone based on how much they weigh versus how tall they are. And so that can tell you just a little bit about their body composition. And so if we see that someone is overweight or underweight, right, if we see like, what type of adjustments we have to make there. So how do we figure out what the BMI is? Well, like I said, it's your weight divided by, it's your height divided by your weight. So that, or weight divided by your height. And so that's going to be your weight in kilograms divided by your height in meters squared. I know a lot of you guys in this debate. This is a formula you got to get memorized. We don't memorize too many formulas in the world of personal training, and you'll never ever have to do math on your assessments or anything. But if they ever ask you like, what is this formula? It's the formula for body mass index. So we do need to be able to kind of recognize it. So weight in kilograms over height in meters squared. There is also the silly American version, which is weight in pounds divided by height in inches squared. Then you take that entire, whatever number you get, you take that whole thing and you multiply it by 703. Because it gives you this really, really weird small decimal number. So you need 703 and it'll give you a BMI. But don't memorize the American one. Do the European one. That's like, or honestly, the entire world one. That is the formula you'll see on your test. Now, what that's going to do is it's going to give us a flat number, somewhere between, hopefully somewhere between like 18 and a half and, maybe somewhere below 25, like somewhere in there, hopefully. But it could be higher than that. So if it is anything less than 18.5, that's actually showing us that our client is underweight. That's going to be classified as, that's an indicator of like disordered eating, like anorexia or bulimia. That's our underweight category, right? But then we have normal weight. And that's going to be anywhere from 18.5 up to about 24.9. So that's what we are looking for. This is the ideal area that we are kind of aiming for. We've got overweight, which is anywhere from 25 to 29.9, so just below 30. That's the overweight category. And then obesity is anything greater than 30. So that is sort of, and these are some other numbers that you need to kind of be familiar with. I would recommend the big one is memorizing like obesity and sort of just what normal weight is. If you can remember 18.5 to 24.9 and then anything greater than 30, you'll remember the rest of these. Now, you can see this is just me putting in notes here. It's not an indicator of health, right? It's just a calculation of your height versus your weight. However, it should be noted there is a correlation between excessive BMI and certain health risks. I'm not saying it's causation. We're saying there's a connection, there's a correlation there. So we do tend to see individuals that have excessive BMIs above 30. They are at a higher percent risk of certain chronic health illnesses, right? So when we consider things like that, we're talking about, it's like playing, it's like, gambling in a way, like you are not guaranteed to win anything when you're playing roulette, if you put money on one number. But if you start checking off more boxes, you put money on more numbers, you're more likely to, sort of strike it, right? That's sort of how obesity really works, right? Like you're not necessarily guaranteed to catch any chronic illnesses, but there is a correlation there, and you put yourself at increased risk. You're basically putting more money down on more numbers, the higher and higher your BMI goes. So we do see that there are some risks here. Population reveals that about 33% of U.S. adults are obese, men in particular. We're seeing about 35% of U.S. adult women are obese. And then we do see higher statistics there, higher rate of obese women in like Hispanic and non-Hispanic Black women. Those are much more common. A lot of that, going back to our conversation, comes down to like cultural differences, social differences, economic differences, right? All the things we kind of talked about yesterday in why we're seeing kids get obese and kids deal with chronic illnesses more. And that is absolutely coming from like us designing, our world in such a way that like it's not helping people, right? Not awesome. So both figures, by the way, all of this is for adults that are 20 or older. We're not necessarily looking at youth statistics here. Those youth statistics are obviously a little bit better just in terms of like the overall numbers, but they are still growing at a really rapid rate. And that is something we all need to be aware of. So if you do get questions related to this, if you do see this kind of stuff on your test, be aware of the differences in those statistics, and be aware that like the big message here is that obesity is growing in every population, and definitely something we need to improve. So altered physiologic responses with obesity. So we definitely see the body respond a little bit differently to exercise, or really differently to kind of anything in relation to obesity. So some of the things that we're going to see an increased insulin response to glucose. Now, here's the thing. When I say insulin response, what I mean is that your pancreas will create more insulin with less glucose. And the reason for that is because we will actually find that we have a decreased insulin sensitivity. So that makes, what ends up happening is like you're creating so much insulin that your cells are starting to become resistant to it. You know, they're starting to become not as affected by that insulin. So it has very, very, very negative effects, right? This makes the body very resistant, which means that sugar is going to pool in your blood, and that can eventually lead to diabetes if your fasting insulin levels remain very, very high. It starts interrupting a lot of your other metabolic features. We also see a decrease in human growth hormone. Remember, growth hormone is a very important hormone that helps us, develop the human body, right? It's a hormone that triggers like growth. Well, we see a decrease in that. So your ability to gain muscle and lean mass and things like that is actually reduced. It is harder to gain muscle when you are obese than it is when you are leaner, which is a freaking bummer because that is the population we need to gain muscle. We also see an increased adrenocorticotropic hormones or adrenocortisol hormones. Basically, you are going to see an increased cortisol response to smaller amounts of stress. So you will see, remember, cortisol is a catabolic hormone. It is very good at burning off muscle and building excessive adipose tissue. It is better at building fat and breaking muscle. Not something we want to have happen, and that's why stress is so bad for us, right? So we definitely see an increased cortisol response there, which is going to result in increased fat production. And we also see increased cholesterol synthesis. Our cells will actually make more cholesterol, which will passively sit in our bloodstream and have it is much more likely to clog up our arteries. So a lot of really, really negative stuff here associated with obesity, right? It has very negative effects on all of these different aspects of our life. So it makes sense that we are trying to manage this as best as possible. And this is one of the things that, this is the most common thing that our clients are going to approach us about in order to, seek improvement, right? The number one thing you guys are going to be hired for is weight loss, because it's the number one thing that people are dealing with here in the US. Like we see it very, very, very commonly. Most of the population is obese and is trying to get their health in order, right? So most of the population is seeking, weight loss. So our recommendations, how do we, if we're just looking at some of our general rules, well, we really like circuit style training when it comes to resistance, right? Like when it comes to resistance training, circuits are going to be a really effective tool in your arsenal to combat obesity because it burns a lot of calories, right? This is 5 or 6 exercises in a row with little to no rest in between. I don't know if you guys have ever done, is anybody in here, anybody in the call today? Have you guys been to Orange Theory Fitness?
No.
No? It's
No.
it's super fun. I will say we used to teach classes just like this at BLR, but like basically what it is they actually hook you up with a heart rate monitor And then while you can actually see there's like TVs in the background. And what happens is there's an instructor that will lead you through specific heart rate zones, and your name is punched into the computer, which is then projected onto the TV, and it shows what your heart rate is, and then your color will change, like if you're in the blue or in the orange or the green or the yellow or whatever. And they're trying to get you into specific like target heart rate zones. And so, the trainer can come along and be like, Bob, you need to, hit that plus sign a couple times. Tammy, you need to bring it down a little bit. You're actually going a little too hard. Right? We're not trying not to be in the orange zone just yet. So it's kind of fun. It's a really cool approach. Then the other half of the class, speaking of circuit training, the other half of the class is that you can see there's like a weighted area in the back. And so there will be a circuit style training. So you'll actually alternate between like cardio and weights. And I think the classes are an hour, maybe they're 45 minutes. But like it goes by so quick because you're just constantly moving, and there's lots of music playing and stuff. And the lights are orange. So it's super, super fun. So that's, great for burning a lot of calories. Now, is it good for building strength? I'm not a huge fan there. I mean, the heaviest dumbbells I think they have are like probably 15s. Maybe they have 20s. But that's not what it's about, right? It's about burning a lot of calories. So it's very much like circuit style training, which burns a lot of calories, right? So that's definitely a recommendation for our obese clients. We also want to try to increase lean muscle mass as much as possible. Now, it's going to be tough considering that there's more cortisol and less growth hormone and things like that. But increasing your lean muscle mass will increase your caloric burn passively, right? So if we consider, let's just go to like a BMR calculator here. So BMR, basal metabolic rate, very, very different than BMI, which is body mass index. Let's say we got a 30-year-old client, we'll say 5'10", and yeah, we'll say, let's say 175 pounds. They're 175 pounds, and we're going to use the formula we're going to use to calculate this person's calories per day. We're going to use the Ketch-McArdle formula, which is going to take into account their body fat percentage. So let's say this 5'10" person, 175 pounds, has 25% body fat. If we hit calculate here, they are going to be burning 1,656 calories every single day. Now, let's say they get on they start going to the gym, they start managing their diet a little bit. And in a couple months, they drop their body fat percentage down to 20%, but their body weight goes down to 170. So they dropped 5% of their body weight, but they dropped, 5 pounds, but they've dropped 5% of their body fat, right? So their BMR is going to go from 1,656 to 1,702. Their number of calories that they burned every day went up, even though their body weighs less. Now, eventually that's going to tip, right? Because fat does burn calories. It really, it's still there, right? If this person was 20% body fat, or if they were 25% body fat and they weighed 185 pounds, right? That's 1,729 calories. So we can see, like, obviously, like, just heavier, even with a higher body fat, can still be higher than our other number, right? But if this person lost 5 pounds of body weight, but that was probably like 7 pounds of body fat, and they maybe gained 2 pounds of lean mass, that 2 pounds of lean mass is going to burn about 4 times as many calories as the 2 pounds of like fat that it is replacing, right? So their weight may not fluctuate very much. We go to 175 pounds here, and we said that person was 25%, right? There's that 1,656. But if they were 175 pounds, let's say they were like 10% body fat, right? This is like, bodybuilder, fitness model stats right here. I'll bet you, I don't think Chris Evans is like over 6 feet. Maybe he is, but like I wouldn't be surprised if he's somewhere around like these stats. If we calculate here 10% body fat, watch this, but still 175 pounds. This is going to go up to 1,900 calories per day. That's 200 calories every single day that this person burns passively without doing anything. Now, if we know there are 3,500 calories in a pound of fat, let's just say they made an adjustment. Let's say somebody lost a little bit of body weight, gained a little bit of lean mass. We increased their lean mass just enough to have them burn an extra 50 calories a day. That's it, 50 calories, right? 50 calories every day over the course of a 7-day week. That's an additional 350 calories every single week. And there are 3,500 calories in a pound of fat. So just by gaining a little bit of lean mass and burning an extra 50 calories every day, that is going to take you 10 weeks and you will burn a passive free pound of fat that you didn't go to the gym for, you didn't do anything for. You burned that energy sitting on the couch watching Breaking Bad. I don't know, whatever people are watching on TV nowadays. Right, that's awesome. So we love an increased lean mass in terms of, managing obesity. We also are going to generally consider that we are performing exercises in a standing or at least a seated position. So for 2 reasons here. Number one, again, like I mentioned, you don't want to have to take your client down to the ground and get them back up and down to the ground and get them back up, right? That can be painful, it can be exhausting, it can be irritating. But if we focus more on standing exercises, that actually is going to burn more energy. Now, if your client starts to get exhausted and standing becomes really taxing, you can always move to at least an upright seated position. But that's what we're going to prioritize. Start with at least an upright seated, bare minimum, but if you can, get your client in standing. So do I like the bench press? Yeah, I think it's great. I love like chest presses. I think that those are terrific movements. But if my clients, if my priority is to burn calories for my client, right? If my priority is to burn energy, well, yeah, the chest press may build strength better, but the standing cable chest press, like the dumbbell chest press is probably going to build better strength, but the standing cable chest press will burn more calories. And that's my priority with this type of client, right? So definitely something to consider there. SMR can be okay. It is typically recommended for home training if your client is self-conscious. A lot of times people will have a little bit of a challenging time holding themselves up, so foam rolling can get a little uncomfortable for some clients. Also, if there is like a lot of pressure, it can be very, very painful. So instead, we have a lot of we have a lot of alternatives, right? We have tiger tails, Theracanes, those kind of things are really, really good substitutes. This is the Theracane, by the way. I know I mentioned it in class a couple, like a week ago or something. And it's this thing that you can kind of grab at different angles and work in there and give yourself a little massage, It's a great way to get into your lower traps. I mean, upper traps, which can be a real pain in the butt. This one right here. And then right there. Oh, SEM. So be cautious. Other things, be cautious placing your client in a prone or a supine position. That can be fine, but if they have hypertension, we need to be aware of that. Placing them face down, facing them face up, it could cause blood pressure drops, and they could get that spotty vision. So we do have to be cautious of that if they have that. And we know that it's commonly associated with obesity, but not necessarily always. And then we're going to focus primarily on phases 1 and 2. So if we look at that OPT model, we are primarily spending our time in this bottom section of the pyramid, right? Phases 1 and phase 2, because these are our 2 highest calorie burning. Now, earlier I did say like muscle building is very effective for obesity, right? Well, maybe we start to incorporate phase 3 as well. But generally, these 2 are our biggest, highest calorie burns. There's definitely some here, but these up here are not bad. But with excessive body weight, focusing on max strength training, like high percentages of your 1 rep max, is putting even greater stress on the body. And it doesn't burn very many calories, unfortunately, because it does have very, very, very long rest periods. So here's sort of our table from our book, right? You can see if we're considering fit principles, right, the mode, right, the type, We're going to focus primarily on low impact activities such as treadmill walking, or maybe using a rowing machine or using a stationary cycle, right? Those are the type of things that are going to burn lots of calories, which is going to help with our client's energy balance, but they're not high enough impact to cause like any problems in the joints. We're looking for frequency of about 5 days a week at least, because we want this to be a lifestyle. We want to see a consistent calorie burn, and there's a lot of damage that can be done on days where you're basically not doing anything active. Our intensity is going to be anywhere from 60 to 80% of your maximum heart rate. That means that we can use the talk test to determine that, right? We're basically going to be in an area where you can speak entirely comfortably, up to maybe where it starts to get just a little uncomfortable while you're talking. You're a little breathy, into like maybe you have like a couple little stops or pauses. We never really get into the full on talk test where it's like they cannot speak, they are working as hard as they can. That's maximal intensity. That's probably going to be high impact, which is probably going to cause problems, so we're going to avoid that. Our duration is anywhere from 40 to 60 minutes a day. If they cannot do a full 40 to 60 minutes, we can focus on 20 to 30 minutes, broken into like 2 different sessions. Again, we got to remember that like an obese client is probably, that's a lot more weight on every single one of the joints in the body. So we are probably going to be a little gentler there and probably break that into shorter sessions. Our assessments, pretty normal stuff here: pushing assessment, pulling assessment, overhead squat. We'll probably do single leg balance over single leg squat. If that's possible, we're still going to sort of observe to see like how their balance is. Flexibility, we can do self-myofascial release if it's tolerated, like we said. But other than that, you're going to follow the entire flexibility continuum. There's no reason you can't do static stretches. There's no reason you can't do active. No reason you can't do dynamic if you do have them doing like power exercises. For resistance training, pretty classic stabilization style stuff here. 1 to 3 sets, 10 to 15 repetitions, about 2 to 3 days per week. Really nothing fancy there. But special considerations, please make sure that your client is comfortable. We want them to build a positive relationship with the gym and with working out. If you are putting your client in uncomfortable situations, they might start to draw negative associations with the gym. And then they'll stop coming, and that's definitely not something we want to see. And then exercise should probably be performed as often as possible in a seated or in a standing position. If you consider that, you're going to be burning lots and lots and lots of calories. So that is our obese client. Any questions there, guys?
I have a question. So what if, okay, I understand they're obese, and they get a little, they show up, they work out. The next day they're overwhelmed. Oh, I can't do it anymore. I'm aching everywhere. How do you my
manage
question?
pains?
I'm sorry?
How do you manage the aches and pains?
Yeah, they're just not, they can't come out of the bed.
Yeah, it's tough. It's a really challenging, like one of the best things you can do is before you start to deal with that, is to do what I like to call like manage your client's expectations. Like explain to them like, hey, like this is new for you and your body's gonna freak out. And when your body freaks out, it basically goes into inflammatory mode. It just goes and it swells everything up, and because your body doesn't really know what's going on, why we went through so much like stress. You're gonna be real sore tomorrow. Now, ways you can manage that are things like heat is going to be really effective. So take a nice hot bath, take a hot shower, try to relax. And then a little bit of flexibility is going to help with that, for temporary relief. But here's the thing, and this is the bummer, and your clients will actually probably not believe you when you tell them this. But the like stretching after a workout actually does not have much of an effect when it comes to getting the aches and pains associated, like that muscle soreness. Stretching actually does not really help with that. I know you guys are thinking, yes, it does. I've done lots of stretching on days that I'm really sore, and it has an incredible effect. Yeah, temporarily, it really actually will. But the best way to keep from being sore and this is why your clients will never believe you when you say this, is to actually to do a little bit of cardio. So when you do a little bit of cardio and you do just, it's some gentle like walking activity, I'm not saying sprints, I'm saying gentle, like, you know, a little bit of physical activity, go for a walk around the block. It has very big positive effects because it pumps blood around your body and it actually flushes out some of the remaining lactic acid, which is, you know, sitting there damaging your muscles further. So by doing a little bit of cardio at the end of your workout and in the beginning, like the next day, can be really effective ways for managing those aches and pains. Does that answer your question?
Yeah. Yes.
Cool. Now, and by the way, like there's other aspects to it too. It's not just the aches and pains. Like sometimes your client's just like, I don't know if I can do this. I don't know if I can deal with this level of pain, you know, consistently in my life. I don't know if I can, like, you know, they'll start to get really overwhelmed. This is another one of the things that we want to do. We want to make sure that we don't always like just jump right in to giving your client like, you know, a new workout routine, cardio homework, flexibility homework, you know, core homework, and then like change their entire nutrition plan, you know, like incorporating all of that at once, it is really overwhelming, you know. But instead, if we can just make small changes in the lifestyle and adopt like healthy behaviors on the regular, it has very positive, very, very, very positive effects. And so you'll often manage your clients' expectations that way, and then encourage them, be like, hey, you know, give me a week. Like, you know, you're going to feel a lot better after this first week. It really does. Like, you know, it's always the first week of a new routine that you're really sore, you know. I'm starting a new routine like next week, and, you know, I know I'm going to be just like, oh, you know, a lot achier, a lot more painful. But it goes away. It goes away after that first week. All right. So let's take a look at diabetes. This is another really common one, right? Diabetes, highly associated with obesity, very common, right? So we kind of talked a little bit about this already, but we've got the difference here. There's diabetes is in general a condition in which an individual has an impaired glucose control, right? They're not controlling their blood sugar effectively. So what do we mean by that? Which type of diabetes do they have? Are they type 1 or are they type 2? So type 1 is where we call that insulin dependent diabetes, which is kind of funny because they're both insulin dependent, really. But it's insulin dependent because they need insulin because their pancreas is not creating enough of it. So basically in type 1 diabetes, you have a bum pancreas that doesn't create enough insulin, and therefore sugar just stays in your blood. It doesn't ever get driven out for energy production or storage or anything. And so then it you know, it's in the way and it causes your cells to suffocate. So your body's not producing enough insulin, right? That often results in what we call hyperglycemia, which is high blood sugar levels, or, you know, what can sometimes happen if they take too much insulin, or if they, because of having such high levels, burn through like a lot of energy. And then they do so much work, which causes their blood sugar levels to drop. They might also end up with hypoglycemia. So that's low blood sugar levels, which can cause like fainting and things like that. So you will see hyper and hypoglycemia. This is often seen in younger individuals, are often where we sort of spot type 1 diabetes, which is why this is often referred to as childhood diabetes. And that is less than 10% of cases. Most cases of diabetes are going to be insulin resistant. That is your type 2. So your body has actually become resistant to insulin. It got so used to making insulin that now your body cells are, you know, they require more and more and more of it. So the body has actually become resistant. This is often referred to as adult onset diabetes, and it can cause hyperglycemia, you know, that excessive blood sugar levels, which can damage your heart, your nerves, your kidneys, your circulatory system, your eyes. It can result in glaucoma, you know. So we definitely do not want to see like chronic high blood sugar. Yeah, it can damage your nerves. Your nerves require a lot of oxygen. So when they don't get oxygen, they get damaged. And when they get damaged, they can't act like nerves anymore. You know, your nerves' job are to carry signals throughout the body, right? So that results in a condition that we call neuropathy. And neuropathy is basically nerve damage that either results in numbness or tingling in specific parts of the body. This is usually neuropathy is going to be referred to, we call it peripheral neuropathy. It often happens in like the fingertips, or most commonly in the feet and toes, which are just areas that are very far away from your central nervous system, and also areas where the nerves get very, very small and there is not very much blood flow. So due to that lack of blood flow, there's less oxygen delivery, cell death, right? Numbness or tingling, usually in the extremities. We will also, like I said, see kidney problems. Your kidney has to process extra materials, and so it has to keep up with that. Remember, your kidneys are basically like a friggin' Brita filter, you know? And there's just filtering out stuff all the time. If it has extra stuff to filter, it can get clogged. And then glaucoma, like I said, in damage in the eyes, right? So special considerations we want to make. Our target goal of maybe 1,000 to 2,000 calories of energy burned per week through exercise. So if we're just aiming for a simple 1,000 calories, if you go to the gym and just burn about 250 calories, you know, if you literally just get on the treadmill, enter your statistics, and just walk until you see, you know, 250, and you did that 5 days a week, that's actually a pretty good way to start managing your diabetes. And we can take that number all the way up to 500, by the way, depending on your client. So we're aiming for 1,000 to 2,000. The reason we're putting a number of like calorie target burning here, rather than just like general activity or hours of minutes of exercise and things like that, is because you got to think about like how calories work in the body, right? Your body takes in nutrients, carbohydrates, proteins, fats, vitamins, minerals, water, right? And those big three, the macronutrients, proteins, fats, and carbs, they get into your body and they are used for energy, right? Like protein is primarily used to like repair the body. It's made to make new body tissues. But fat is used as like an energy source. And carbohydrates are definitely used as an energy source. That's our preferred energy source, right? So your body can store carbohydrates for use later. And that's actually where you use them from. You actually use them from your storage. So if I like this, you know, this coffee has like a little bit of sugar in it and a little bit of like milk and stuff. So it's got carbohydrates in it. And so those carbohydrates are getting into my bloodstream and then they're getting stored as glycogen. And then that glycogen is getting broken down for energy as I need it, right? But if I don't burn very much energy, well, then I don't ever break that glycogen down. And then if I put more sugar in my blood, then my body's like, all right, well, we're going to store it as glycogen, but it can only store so much. So what ends up happening is if your glycogen stores are full, there's nowhere for that sugar to go, it will get converted into fat instead and stored as triglycerides in your fat cells. So, and that's insulin's job, right? Insulin's job is to push it into glycogen or push it into, you know, becoming fat cells. So the reason we focus on like a calorie burn is because we are actively trying to deplete 1,000 to 2,000 calories worth of glycogen from the body. If we can break down 1,000 to 2,000 calories worth of glycogen, then your client is much more likely when they bring in sugar into their blood, it's much more likely to get stored as glycogen rather than getting converted to fat, or rather than just passively sitting in the blood and causing problems. Does that make sense, everybody?
Yeah.
Yeah, that's a big concept. So I'm like, and by the way, you know, for those of you who have been through our exercise physiology class, which I think that's just Kenny, Andres, and Dalen, because that's the weight loss mod, you'll remember you burn more carbohydrates at higher intensities. So when I say like go to burn 500 calories in the gym, the faster you can burn those 500 calories by like working more intensely, the more you are getting a greater percentage of that 2,000 calories per week being mostly carbohydrates. Because that's the thing, right? When you burn 2,000 calories per week, some of it's going to be fat, you know, like when we look at like respiratory quotient here, you know, if we look at this chart, right, if you are at an RQ of like 0.75 or let's say like 0.8, right, 33% of the calories are coming from carbohydrates, 66% of them are coming from fat. That RQ of 0.8 is pretty low intensity. That's like probably walking on the treadmill. So you're burning mostly fat, but some carbs, right? And our goal is to burn lots of carbs if we have like a diabetic client. Like, don't get me wrong, we're trying to burn fat because we want to like, you know, want to lose body weight maybe. But our priority is to burn carbohydrates as a fuel source so that we can increase that insulin sensitivity. So if we take that RQ all the way up to like 0.9, which is going to be right around like zone 2, where we like 80% of your max heart rate, they're going to burn 67% carbohydrates and only 32% fat, which means that 2,000 calories, you're going to burn 1,340 calories worth of carbohydrates, which is going to be about 335 grams. Pretty good, right? Pretty darn good. So that's definitely something we're going to put a little bit of emphasis on. We like high intensity exercise actually with our diabetic clients, if they can handle high intensity. Got to be cautious because you don't want to do too high intensity, which pulls all the sugar out of your blood and then all of a sudden they pass out. So measure your glucose levels before and after exercise. Encourage your clients to do that regularly. Increase complex carbohydrates. We like complex carbs. This is a general rule for most of our clients. The reason you hear people say like complex carbs are so much better, like I hate the term good carbs versus bad carbs. I don't like that approach. I think that is a silly way to label things. I mean, I get it. I get the idea. It's like, yeah, bad carbs are things that are like, you know, mostly in sugar. But it's not helping anyone like learn the proper terms. So I definitely like complex carbs, which are typically very, very good, versus simple carbs. And complex carbs are going to be things like vegetables, whole grains, whole wheat, whole grains, right? Versus simple carbs, which are things mostly primarily made out of sugar, you know. So complex carbs, right? We love brown rice. We love whole wheat bread. We love potatoes, sweet potatoes, which are, you know, or yams, whole wheat pasta, fruits, vegetables. Fruits can actually be relatively simple sometimes, but they have vitamins and minerals in them, and they are still slightly more complex than some of the other very simple carbs you'll see over here, right? Cookies, candy, chocolate. What was that? Juice? Probably juice. Oh, it's probably soda. Or no, that's soda. Yeah, probably juice. Soda, energy drinks, donuts. You know, and then like French fries, which are made from potatoes. French fries can actually be somewhat complex, but generally they're like skin removed, which means that they lost their fiber, which means they're less complex, right? So all of those things are much simpler. So what happens is when they get into your bloodstream, they're already broken down. They're simple, right? Boom, instantly raises your blood sugar levels. Versus a complex carb where your body's like, oh man, I gotta disassemble this whole thing. You know, like it's a much bigger, you know, there's a lot of like individual little pieces. So it's gonna be much more difficult for your body to break it down, which means it's gonna raise your blood sugar levels more slowly, which gives your body time to, you know, empty out glycogen stores more effectively and then refill those glycogen stores. Use weight-bearing exercise cautiously when you are working with obese clients, and always wear the appropriate footwear. Now that seems like something that doesn't sound very personal trainery. I know it doesn't have anything to do with dumbbells or physiology or anything. It's weird, right? Like we're going to instruct our clients on the right type of shoes to wear. We are very much so. This is a huge deal for clients who have diabetes because if they have peripheral neuropathy, right? Remember, peripheral neuropathy is a numbness or a tingling, usually in the extremities, right? It's usually in the feet, It's usually in the fingertips, right? Now, if that happens, what can happen there is you can actually um, lose sensation, and you can actually see it here, right? You can see like blood is pooling in specific areas, right? And what can happen is if you lose sensation in that area, and then all of a sudden, because you're wearing the wrong type of shoes, let's say you get like a blister, right? Let's just say you get like a normal, we've all had like a blister, right? Maybe doing too much cardio or running through something, and it hurts. It's a freaking hole in your skin. It's kind of a pain in the butt, right? Well, if that happens and you don't have sensation in your feet, if you get a blister on the very bottom of your foot and you can't see it and you are unaware that you have it, are you going to take time to like clean that wound out? Probably not, because you didn't know you had a wound. And then that is how that foot gets infected, which can lead to gangrene. It can lead to all kinds of things, and that can lead to the loss of that foot. Very, very, very dangerous, right? So always make sure that your client is wearing like wicking socks, sweat-proof socks, and always like make sure the shoes are not too tight, not too small, and instruct your client to pay attention to their feet. I know it sounds very odd. I know it doesn't sound like something that, we would have to deal with. But I used to, when I worked at Biggest Loser, dude, we had to constantly have conversations and check clients. We were like, keep an eye on your feet. You guys are hiking 2 hours every day. It's not gentle on your feet. Oh man, we had this one woman. Oh, she was from Hawaii, and I don't know what it's like in Hawaii, but she's like, I just don't wear shoes. She's like, I'm just barefoot my whole life. She's like, I'm either barefoot or I'm in flip-flops. And so like wearing shoes and socks tore her feet. She had the softest feet. They just were not used to like friction in any capacity. And I've never seen blisters like that in my life. I was like, what is going on? And we got her nice socks, we got her nice shoes, but it was intense, man. She had a blister the size of like a dime. I was like, oh my God. So anyway, always keep an eye on that. We don't want to get we don't want those things to get infected. And one thing to always be aware of with, as your client starts to exercise more regularly, their sensitivity to insulin is going to increase, which is freaking awesome, right? As their English words, as their insulin sensitivity increases, that means that their insulin that they are taking synthetically, like if they're taking like an insulin shot, could have a much stronger effect. And so it could cause them to become hypoglycemic, which can cause them to pass out. So instruct your client like, hey, like after you've been working together for a couple of weeks, make sure they are meeting with their doctor regularly to make any adjustments that they need to in regards to like their insulin. And hopefully we'll get them off of insulin entirely. That's the goal, like that's really what we're aiming for. And let me tell you, it's awesome, man. There's nothing like the high five, high-fiving a client who's like, guess what? I don't have to take any more. I don't have to poke myself with a freaking insulin needle anymore. Awesome. It's so great. It's always great to celebrate victories with your clients. Like, hey, you lost 10 pounds of stuff, but man, the medical ones are just, oh, they're so satisfying. So, mode, our type of exercise, right? Low impact activity, right? Because we've got to be cautious about the feet, right? Walking, rowing, or stationary cycle. So this is going to be very similar to our obese clients. Frequency, we're going to take it up just a little bit higher even than our obese clients, 4 to 7 days per week. We kind of need to regularly empty those glycogen stores so we can get that frequency a little bit higher. It does start kind of low though. Sometimes we'll see it as low as 4 days per week. If you're being very intense, if you can do like more intense exercise, you can be a little bit, you can kind of change it up a little bit. Intensity, 50 all the way up to 90% of heart rate max. So we can take this into the beginning of zone 3, where we do get even more intense about things. That's great, actually, if your client can handle it. But that's a great way to, again, ensure that you're emptying out those glycogen stores. What percentage of fat versus carbs burned 90% heart rate max? There we go. So if we are working out at like 90% heart rate max, that's somewhere right in between here. You're only burning maybe 15, 20% carbohydrates, but you are burning, um, 80 to 90% carbs, which is exactly what we want. I know sometimes, by the way, that sounds like, well, how's that going to help someone lose weight? If we're burning carbs, aren't we supposed to like burn fat? You got to remember, this is not linear, right? This is not like, when you burn fat in the gym, it's not like you're just walking away with like less fat. When you're burning carbs or fat in the gym, like your body is going to deal with that in the future. So if you empty out all your carbohydrates while you're in the gym, and then let's say, it's someone's birthday at the office and they bring in cupcakes or something. Those cupcakes are not going to get converted into body fat. They're going to get converted into glycogen and stored. So that's going to be, you had a positive effect in the future based on what you did in the present, right? This is something, it's an investment for your future, right? And then the same thing is true. Like, you got to remember that you are then going to passively sleep, and you're going to passively maybe not get calories at certain times. Well, all that energy that you burn through means that you don't have any energy to tap into in terms of glycogen. Your body's going to say, oh, okay, well, yeah, we haven't eaten in like 6 hours. Luckily, I've got like glycogen that I can kind of tap into, right? But if your glycogen stores are empty, where is it going to get that energy from? It has to get it from somewhere. So it's going to get it from your fat cells. So by burning carbs in the gym, you are actually burning much more fat later on. Do not fall for don't make the mistake of thinking, oh, I don't want to burn carbs in the gym, I want to burn fat in the gym, right? Burn carbs in the gym so you can burn fat later. That's better. It's more effective. This is why interval training is so highly effective. Interval training does put more emphasis on burning carbohydrates, but it results in oftentimes, sometimes as much as twice as much body fat burned. So duration anywhere from 20 to 60 minutes, as little as 20 minutes if they're doing really high intensity, as high as 60 minutes. If you're doing 60 minutes, you're probably not doing high intensity. You're going to drop the intensity down a little bit. Assessments, totally normal stuff here. Push, pull, overhead squat, single leg squat, single leg balance. All of them are very good. Flexibility continuum. We like all of them. I will say, you can see special considerations down here. You can use the entire flexibility continuum, static stretches, active stretches, dynamic stretches. However, with static stretches, be cautious. Remember, bruising can occur and it can cause blood to pool in certain areas. We don't want that to happen in clients who might have peripheral neuropathy. They might not feel that they're pushing so hard that they can bruise themselves. So just be a little cautious with that. 1 to 3 sets. You can see we're going to focus anywhere from 10 to 15 repetitions here. I personally like staying closer to 10 because I really like high intensity. Again, I want to put emphasis on like carbohydrate burning, and that's going to happen the lower the repetitions are. So the heavier you are lifting, the more carbs you are using as a fuel source. But if I'm going for a big calorie burn, I'll go all the way up to 10 to 15 repetitions. And we're going to go for 2 to 3 days per week. So you'll notice that we're primarily staying in phases 1, 2, or all the way up into hypertrophy into phase 3. Special considerations, like I said, always make sure your client is wearing appropriate footwear. Make sure they have a snack handy. Diabetic clients, you're going to be a little cautious. They can pass out on you. So make sure that you have some snacks handy. A lot of times I see the mistake of trainers going to like gum. They'll be like, we got some gum, that'll help. A lot of gum is mostly like sugar-free. It has no calories in it. So guess what? That doesn't help. A banana, orange slices, right? All the normal stuff that you would give like a kid who's like low energy, And then, like I said, use self-myofascial release with special care. Make sure that like you're not going to bruise or damage anything on your client. Any questions there, guys? Questions on diabetes?
Nope.
Oh, better not be on my shirt. Okay. Ah. So let's take a look at women and pregnancy, right? So special considerations for our prenatal clients. Decreased oxygen availability during aerobic exercise. So one thing to be aware of is, you've got a pregnant client with a limited amount of blood and a limited lung size. And so, but you have like all of that blood needs to be delivered both to all of the cells of the client's body, but also all of the cells of the growing body inside. And so what ends up happening is there's a decreased availability of oxygen. A lot of times, shortness of breath is very, very common in our pregnant clients. So be cautious of that. If you have them doing cardio, the talk test is going to be a very, very effective way to manage that intensity. Ask your client, like, comfortably, how are they feeling? Are they out of breath? Are they, do they have breath? Are they out of breath? Or are they like, gasping for oxygen? You want to definitely avoid prone or supine body positions, as that can affect blood flow. So you do need to be a little cautious there. Make sure that you're not laying your client face down or laying them face up. Both of those are not positions that are, number one, they're not comfortable. And you'll already get complaints right out the gate. But also, like, they're not considered that safe. So avoiding those positions. Again, this is probably putting a lot of emphasis on staying on the feet or staying in a seated position. You're going to need to see an increase in calories of about 300 per day in order to maintain an energy balance. Now, obviously, like, that caloric intake is probably going to be much more based on a doctor's recommendations. But in general, if you are instructing your client, say an increase of their normal calories of about 300 per day. On average. And then one thing to definitely consider is thermoregulation changes. Your client will often fluctuate body weight rapidly. They will be very, very cold one minute and blazing hot the next. And so it's very important to encourage your client to dress in layers. There's a lot of hormones which are just amping up how fast the cells are running, which is creating a lot of energy very passively. And that passive energy is sort of manifesting itself in the version of heat. And so that raises body temperature pretty darn quick. And it can be very, very, very uncomfortable. So thermoregulation changes, definitely be aware of that. But there's a lot of benefits to exercise. A lot of people oftentimes they'll say, like, oh, well, pregnant client, you got to just take it easy for the next 9 months. And that's not accurate. Those who are already active can absolutely continue activity, even at moderate levels. It doesn't even have to be like low intensity, all the way up until a third trimester. And then they're going to make sort of we call it a logical reduction, where you're basically just going to take it ever so slightly easier in that third trimester, take it down to low intensity and just try to stay active. So our mode here, most common modes that we are going to focus on are low impact exercise or maybe like step aerobics, as long as it avoids like jarring motions, treadmill walking, stationary cycling, and then lots of water activities. These can be water activities can be really effective because it's going to take some of the body weight pressure off, which can be very just like, kind of a pleasant, sort of break from all this extra gravity. Frequency 3 to 5 days per week, pretty standard stuff there. Really seeing no difference there between like your average everyday client. Intensity, probably somewhere, you'll notice here we're actually going beats per minute in terms of heart rate here. That is because we are sort of under the assumption that pregnant clients are between ages of probably somewhere in like 20s up until maybe just like early 40s, right? And so 140 to 160 beats per minute corresponds pretty well with that entire range, with the higher range, applying a little bit more to like a younger client, and the lower range applying a little bit more to the lower client. So that is sort of a much easier way to kind of manage things. Again, it gives you some flat numbers here. Duration is probably anywhere from 15 to 30 minutes per day. We're probably not doing a full 60-minute session. Not that you can't. It's just, it gets uncomfortable. We know another thing that tends to happen is like fluid retention in our pregnant clients. And so a lot of times we'll see like feet swelling and things like that can be very uncomfortable. So after about 60 minutes, that can get rough. So if we can keep our workout sessions to maybe 15 to 30 minutes, it'll be a lot more comfortable for our client. They're a lot more likely to adhere to it. Totally normal assessments. We don't have to make very many adjustments here. Pushing assessment, pulling assessment, overhead squat. If they can do a single leg squat, go for it. If they can do a single leg balance, go for it. Flexibility training, we're going to see mostly static and active stretches as well as like self-myofascial release. You'll notice we're skipping dynamic stretches because dynamic stretches do tend to move through multiple planes of motion. They do tend to change body position into prone or supine positions. And they are sometimes ballistic in nature, which that high impact, that high, that jarring is definitely something we are avoiding for the most part. For resistance training, we're going to go about 2 to 3 days per week using light loads, about 12 to 15 repetitions. We're really keeping the reps pretty high here. We're not trying to gain strength during pregnancy. We're just trying to maintain activity. So 12 to 15 repetitions is going to work just fine. And then avoid that prone and supine position. That's really the things to take into account. Avoid prone and supine. And then again, let me tell you from personal experience, thermoregulation. Make sure the air conditioning is on, or your client will be very upset. So that is our general notes here. That's sort of the lesson part. But let's go ahead and take a look at some SOAP notes here. If we build a SOAP note for a client. So this is for a prenatal client. So this is a client, our client Diane here, who is an accountant. And she is in her first trimester. So in general, if we're looking at our subjective information, right, we asked about her job, accounting, right? Generally pretty sedentary at work, also a very stressful job. And she has to wear elevated heels to work. Probably not during pregnancy, but definitely wearing like high heels at work regularly based on her job there. So based on that, I'm going to look for tight calf muscles. That's probably something that we are going to see. And with lots of stress, I'm probably going to see active trap muscles as well. Her hobbies include baking, particularly desserts is a very popular one. Watching movies, and then she actually really likes to swim, so that's pretty good. She has been a diabetic for about 10 years, so definitely struggling with that. So she's taking insulin daily. She's taking insulin pretty much every single day. So that's one of our like sort of short-term goals, right? Let's see if we can reduce that insulin intake and increase that insulin sensitivity. And other condition, quote unquote, she's in her first trimester. So she's 35 years old. Her BMI is 32.4. So that puts us into the obese category. She weighs 264 pounds. I didn't put height up here. Why didn't I put height up here? We should have height up here. One thing you'll notice, one objective assessment that we also decided to do is the waist to hip ratio. Now that is a really great assessment for measuring abdominal obesity. So waist hip ratio, we're looking at like, how wide the waist is compared to how wide the hips are. If we see that ratio being above 0.9, 0.95 for our women, that indicates abdominal obesity, which puts us at increased risk for diabetes, hypertension, coronary heart disease, lots of things. So that's an assessment that we're going to continue to check. However, we're probably going to take a break from checking that during pregnancy because that's definitely going to get altered. Overhead squat, we noticed that her arms fall forward. That makes sense with the accounting. And we also noticed that the feet turned out, and we saw that forward head posture, right? So all the stuff, feet turning out, probably due to the elevated calves, right? The elevated heels rather. Arms fall forward due to the sedentary nature of her job. Forward head posture, also the sedentary nature of her job. Blood pressure is about 135/85, so that's pre-hypertensive. She's on the road to hypertension. That is another thing we definitely want to adjust. Assessments we're going to keep an eye on. Overhead squat, pushing and pulling. We're going to continually check BMI and blood pressure as well. And you will notice that we skipped her cardio assessment. The full 1 mile walk was a little bit too intense. And the step test is definitely going to be very high impact. So we're going to be pretty gentle on that. We'll come back to developing cardio after the pregnancy. Resistance training, 3 days a week for strength training, 2 days a week of going for a 30-minute swim. So we are getting active 5 days per week, ideally. We're going to break those strength training sessions really down just into 30 minutes. That 30-minute session there, and then 2 days of 30 minutes of swimming, that's going to be an activity of about 150 minutes per week. That will probably result in that 1,000, probably maybe 1,000, maybe up to 1,500 calories burned per week, which is really ideal, right? But remember, this client is pregnant, right? So they need an increased number of calories, but that's still okay. There's no reason you can't burn a substantial amount of calories. And then when that increased calories come in, they're being used in very positive ways rather than getting stored as, body fat, right? Or decreasing insulin sensitivity. So that recommendation can still remain. 12 to 15 repetitions, 2 to 3 sets. We're focusing on low to moderate exercise. And then we are going to do compound or isolation exercises here, right? We're definitely going to focus on using kind of as many muscles as possible if we can. So a standing cable chest press is a really good version. A standing or a single leg cable row, something like that. Those are going to be really, really effective. Trying to keep our client on the feet. Cardiovascular training, like I said, 2 days, 30 minutes in the pool. And then she should be able to hold, obviously she's not going to hold a conversation underwater, but the amount of like out of breath that our client should feel, she'd be able to hold a conversation the entire time. She'd feel pretty confident being able to speak and breathe and stuff. For our static stretches, we're going to put a special emphasis on the lats and pecs. That's going to address the arms falling forward. We're going to put a special emphasis on the teres major. Actually, those 3 are going to address arms falling forward. Lateral gastrocnemius and soleus for the feet turning out, and the biceps femoris and TFL as well. For the feet turning out. For the forward head posture, we're always going to encourage our client keep their head on top of their body rather than letting that head crane forward. And special considerations, we are going to instruct our client to get a good pair of athletic shoes. That is going to have a very positive effect and make sure that like with that diabetes, especially like during pregnancy as well, it's going to be even harder to keep an eye on the freaking feet. So if we end up with a blister, like that can be very, very, very dangerous. So athletic shoes are going to be very important. And we're going to instruct our client to consider parking further away when they're going to the store, right? That's going to have a very positive effect outside their life, That, Bay, you were asking earlier, like sometimes you get a client that's overwhelmed. That type of small change is the type of thing that's great because it actually, it's almost like more stress because like, oh, I got to also change the way I park when I go to grocery stores. But it's the type of thing that kind of reinforces their habits because they actually start to get like, a sense of accomplishment in little things in life. Your clients who start taking the stairs, guys, they love it. Like they'll complain at first. But then they're like, you know what? Like, I love the fact that like I'm the active person who takes the stairs regularly now. So that is a big one. Oh, lost somebody. We lost Dalen. Then we're also going to focus primarily on complex carbs. That's going to be a really big one as well. Like I said, complex carbs are a great way to manage that diabetes, things that enter the bloodstream slowly rather than quickly. And we're probably going to encourage our client to start food journaling. Food journaling is just a really great way to deal with obesity, diabetes, really, really any health related thing. I mean, food journaling is good for everyone. We love a good food journal. In fact, I love getting food journals for my clients as gifts. It is a great way to sort of enhance your business. Your client goes, is very excited by it. So that is basically all I've got for you today, guys. How do you feel about this soap note? Does this all make sense? Any questions on why?
Yeah.
Pretty good?
Yeah.
Cool. All right. All right, guys. Well, homework number 2 is up today. You probably noticed homework 1, pretty gentle. Hopefully everybody's enjoying a little bit of a mental break. This one probably even a little bit easier because the first one's a little bit conceptual. This one is all going to be questions related to pregnancy, diabetes, obesity, youths, or seniors. So you're going to basically, all these questions are going to come from a couple pages. Dalen, you were bringing it up. I think we had said yesterday, like, feel some Brad questions. There are probably some Brad questions in these homeworks. So if there are a couple that feel a little weird, I apologize. Unfortunately, the pool of questions that come from this chapter don't really fit our Sochi, 15 questions per homework thing. Just doesn't, there just isn't a big enough pool of questions from this chapter. So there are probably some that you can tell that I made up, which are not super ideal. I try to avoid doing that as often as possible. I want you guys to get the real NASM experience, but if they don't send us enough questions, then we got to make them up. And yeah, that's about it, guys. Really good job today, everybody. And we had questions asked, which is my favorite thing in the world. So I love that. All right, I'm gonna let you guys out of here. Please knock out that homework. Please do your reading. Check out the pages of chapter 16 there, and I will see all of you all tomorrow.
Okay,